Hey there guys, this is an introduction to a couple of things that I want to teach you, okay? And they work fantastically together. So you might have heard of both, okay? You might not have heard of either of them, and that's fine. Okay, one is functional neurological testing, okay? So that is a way of assessing a body like a neurologist would. It's also how a policeman might assess, back in the old days anyway, how they might assess someone they suspect of drink or drug driving, because the parts of the brain that we're going to be testing there will be affected by drink or drugs, including caffeine to an extent as well, but and high levels of sugar, believe it or not. Okay, so I'm going to teach you that, okay, how to assess your body for sidedness of problems. Okay, so the test might show up that you're midline. Okay, so I need to teach you some terminology. Your midline, basically meaning your axial skeleton, so your skull, your whole spine and your pelvis. Okay, that's your midline, okay, including your organs. Okay, all those midline structures, balance as well. Midline structures, or your intermediate zone of part of your brain. Okay, shoulders, elbows, hips, and knees. Okay, or the lateral zone of your cerebellum. Okay, meaning kind of wrists, hands, fingers, and ankles and toes. Okay, our brain has all those kinds of things all lumped together. Okay, I'm going to teach you how to assess all of those things. Now, you'll be able to self-assess and judge for yourself, is it my left side or is it my right side? Okay, and it might vary depending on which zone we're looking at. Okay, so if I'm looking at my midline, it might show me right side. If I'm looking at my intermediate zone, it might show me left side. And if I'm looking at my lateral zone, maybe it shows me right side again. And then I'm going to teach you PNF stretching, which is a form of stretching. It's called contract and relax stretching. It is a very effective way of developing flexibility on its own. But if we combine it with functional neurological testing, we can rebalance parts of the brain so that your body functions better, stronger, and more efficiently. So if we combine the two, you're going to have a better, fitter, healthier, stronger, more balanced body, which is less susceptible to injury. If you're into muscle growth, okay, you might be then able to stretch and contract your muscles much harder, which might mean that you can, instead of lifting a 16 kilo dumbbell, it's a 20 kilo dumbbell. Instead of squatting 60 kilos, you can squat 80 kilos. Instead of getting your hips to parallel, you'll be able to get your hips down almost to your ankles. Okay, maybe not first time, but over a period of time. Okay, it's going to accelerate progress in terms of flexibility and strength quite drastically, or at least it can be quite drastic. Now, I suggest that you do use this kind of on a regular basis. I'm not expecting you to do it every day, maybe not every time you work out, but if you do it kind of on a weekly or every other week, just see what your body's doing. You might not do all of these tests, and I highly suggest that you probably don't do all of these tests, but maybe you do one or two of them and go, okay, it's that, and that's left, and that's right. Okay, so I need to stretch this, this, and this. Bam. Okay, and it takes 5 minutes. So you need to kind of go into this stuff with a learning head on and go, okay, when I walk, okay, if I've got an injury, if I'm training and I'm noticing this thing's going on, or a problem keeps coming back, an injury, an ache keeps coming back over and over and over again, you're going to now have tools to be able to assess that yourself and deal with it in a much more effective manner than just stretching or just poking it with a finger or just foam rolling it or just doing something. Okay, because okay, it hurts here and I can't do this, so I just need to poke the hell out of it. I just need to stick something in there, I need to go get a massage. Not necessarily true. Okay? We need to have a quick assessment, and then we need to kind of attack it from a more logical, neurological route. So what is PNF, proprioceptive neuromuscular facilitation stretching? What is it? Okay, so proprioceptive, we need to break this word down. Proprioceptive is basically my body's sense of where it is. What can it feel? Where am I? How much tension is in a joint? Okay, what is the tendon in my bicep doing right now? What are the muscle fibers in my bicep doing right now as I do this? Okay, so that is my body's inner sense of what it's doing and where it is. Okay, so I know if I do that, okay, without looking, I know exactly where my hand is. Okay, I know it's just over to the side of my ear. Okay, I know I saw that happen, but if I move it now, my fingers are directly behind my head, okay, and they're waggling around. Okay, and I know exactly what each one is doing. Now, if I didn't have good proprioceptive awareness, I might say, put your hand directly behind your head and waggle your fingers. What might happen, okay, I'm not going to exaggerate, is this. Okay, and technically I'm waggling my fingers, but my hand isn't directly behind my head because my proprioceptive awareness is off. Okay, so proprioception is an understanding of where my body is in space and exactly what it's doing. Okay, neuromuscular basically means the connection between my brain and my soft tissues, my muscles and tendons and bones and ligaments and all kind of the bursa and all the kind of soft tissues that make up my body. Okay, so that's neuromuscular. And facilitation means I just want to make them work better. I want to make them work better. There's a problem with stretching. Okay, you could be the most flexible person in the world, but if you cannot contract a muscle in a stretched position, it's pointless. Okay, so this might be the problem with people who have like EDS, hypermobility. They might be really flexible because their ligaments and stuff are really lax and their tendons are really able to stretch and their muscle fibers are really able to stretch. But if they're in a stretched position and then they cannot contract a muscle, then that joint is unstable. Okay, and that is then an injury risk. Same could be said for anyone, okay? But in someone who's got EDS or hypermobility, kind of same thing really. If someone's got those things, then the risk is higher because they are way more flexible than the kind of your average person who doesn't have those things. So it's a really important way of finding out, kind of giving you, it will give you joint stability. So when you're in a position of stretch, and this is a stretch for my bicep, if I get my arm right up here, let's do it this way. Okay, so that externally rotate, take my arm behind me, my bicep is about as stretched as it can be. Now, can I contract my bicep in that position? Obviously, yes, I can without any weight, but how much weight can I put in that arm and still be able to contract it? Okay, probably not that much. Okay, so proprioceptive neuromuscular facilitation is going to enable me to lift more from more of a stretched position, which will enable me to be more flexible, have stronger, more stable joints, and my brain is going to be more aware of where my joint is in space. And again, that's going to give me additional flexibility and additional strength. My brain will take away flexibility and strength if it's kind of unsure where my joint is. Okay, where is that bone? It's asking these questions. Where is it? What is it doing? I don't quite know what my joints are doing, so therefore I'm going to take away some strength because I don't want to injure myself. Because if I dislocate my hip or break my bones, I'm unable to go out and hunt. Okay, so your brain is protecting your body because it doesn't know where it is. Now there's lots of things we can do with that. Okay, proprioceptive PNF stretching, okay, is one way we can do it. The neurological assessments I'm going to show you are going to identify the areas that your brain is highlighting. Okay, the brain is kind of where is it unaware of? Where is it not sure about? It's going to give you a sidedness, kind of front and back to an extent, but you need to think about these things. And which joint is it kind of primarily at? Is it on my spine? Is it essentially my spine, head and hips? Is it there? Is it my shoulders, elbows, hips and knees? Is it there? Is it my wrists, fingers and ankles and toes? Is it there? Which of those areas do I need to work? Okay, and then the stretching is going to help to correct those errors. Regular stretching will help, PNF will do it faster. And it will be more developmental in terms of your flexibility and strength. Whereas stretching alone might correct them, but it's not as developmental, it's not as effective. Hey, there is something else we can cover, and I'm not going to cover it in this set of videos. We can do something called complex movement, okay, which might be kind of just getting your joints to act in different ways. Okay, it's normally slow. Okay, so this would be for my shoulder. Okay, it's be normally slow movement where I'm really concentrating on what my shoulder is doing, and I'm taking it through various different ranges. It can be kind of freestyle like this, okay, or it could be a bit more structured, okay, and you can do all sorts of things, okay. You can start rotating your body almost like dance. This is why I like dance, this is why I like martial arts. If people are doing those, they are going to have much better joint proprioception. They will probably be stronger, healthier, and just enjoy, even compared to going to the gym. Okay, so dance, martial arts, gymnastics, anything that gets your whole body moving in unconventional ways, in different ways that challenges your brain, that challenges your body, you are going to get much more strength, much more flexibility, much faster than if you were to simply do like a physio program or go into the gym and lifting weights.